from the station that's working for you. You're watching Fox 4 News at 5.
Out of all the respiratory illnesses we're talking about, pertussis may be the most contagious.
A case of whooping cough at a Metro high school. It has health leaders on both sides of the state line on high alert. This is cases in both Kansas and Missouri are on the rise. As we welcome you into Fox 4 News at 5, I'm John Holt.
I'm Bria Love. Health leaders say there's no need to panic, but it's going to take all of our effort to keep these cases under control. Fox 4's Malik Jackson live on Hospital Hill tonight. So Malik, what can you tell us about this known case?
Yeah, Bria, Blue Springs High School, they have alerted parents that a student has been infected with this whooping cough illness. This comes as the Jackson County Health Department says they've seen a rise in cases over the last 4 weeks, and they're not alone. Tonight, Blue Springs High School at the center of a contagious respiratory illness outbreak.
Concerned about the timing, we have influenza season coming. We know RSV is starting as well, and to add a third component, pertussis, we just have to be vigilant.
The school recommending any students and staff that will have contacts with infants who are most prone to get really sick from whooping cough to get a vaccine. They say in part in a statement, it takes all of us to keep our school healthy. Please keep all ill students at home until they feel better, have ruled out infectious disease, or have a doctor's recommendation to return to school.
Very concerned about how contagious it is, and especially in close corridors or settings like a school where people are breathing and coughing.
It can take anywhere between 5 to 21 days to get symptoms, which include violent and rapid coughing, nasal discharge, watery eyes, fever, and more. The illness most dangerous for infants under the age of 1 and our elderly. While there is a vaccine for whooping cough, according to federal data, U.S. kindergarten vaccine rates have dropped since last year, and the exemptions to avoid vaccinations reached an all-time high.
I think getting a grapple on this is important to protect our children.
And Dr. Sood says there at KU Hospital, they've not only seen more people coming in that have been exposed to this, but actual cases they're having to test for. So this isn't just happening in one county or another. This is something we need to be vigilant about across the metro. And again, like we stated at the top, it's not a time to freak out. It's a time to act. For more signs and symptoms and tips, you can click on this story on fox4kc.com. From Hospital Hill, I'm Malik Jackson, Fox 4, working for you.